Doc. Great conversations and education on relevant health issues management. Hello, Doc.
Hello, Doc.
Make a date with our health professionals on the drive with the area gang. Mondays 2:45 to 3 p.m. Hello, Doc. Hello, Doc.
Hello, Doc.
Well, so all through this month of October, we'll be taking a look at breast cancer, getting all the information that we need on breast cancer, and also busting some myths about breast cancer. Today, we're actually going to be looking at prostate cancer, but before we do that, we just want to wrap up, appropriately, breast cancer for the month of October. So, you're welcome, Doc.
Thank you.
And how are you? How's your weekend?
Oh, good, by God's grace, as usual.
Okay, that's good. Any significant thing that happened over the weekend?
No, actually, I wasn't too well, but...
Hey, doctors too get sick. When I was a kid, I used to wonder. I thought doctors and nurses didn't get sick. I grew up and realized that. And you know what fascinated me? The nurses who will give you injections. Some of them, the way they are scared of injections. I'm like, hey, you nurse, when we come here, you are giving us injections. When you have to take injections, even medication. I don't know. If it's a thing with health profession, they don't like taking medication. It's more of a case of do as I say, don't do as I do. But I hope you're better now.
Oh, by God's grace.
All right. So we've been taking a look at breast cancer. I just want us to wrap it up, and then today we'll talk about prostate cancer. So anything, let's just do a recap. What we've been talking about breast cancer.
Just to reiterate what cancer is, that cancer is an uncontrolled multiplying of cells of any part of the body. So breast cancer is when the uncontrolled multiplication occurs in breast cells or breast tissue. And so the thing is, we don't really know the number of people because not enough women get screened on a yearly basis. So we want to encourage more women. That's why we have a whole month for encouraging women to screen for breast cancer, to do self-breast examinations. And this month, the hospital has been doing free breast screenings for anyone who comes in. And I mentioned I think the imaging people around the hospital are all giving discounts for mammograms and all those
this weekend, we had a symposium on breast cancer here at the West Hills Mall. And one thing I learned was that I think that a lot of women, when they get breast cancer, they think it's a death sentence, so like, if they get to know they have breast cancer, it's like they've given up, but we are told that early detection actually works magic. I mean, if something can be done, that early detection will do the trick.
So as I mentioned, the stages and all that. So once you detect it as an earlier stage, the higher the chance of survival, the higher the chance that it will not reoccur again. But if you don't detect it early, that's when the issues arise. So let's examine our breasts regularly. Let's do the mammograms, especially those above 50 years, and then let's be able to find it early, and then take the necessary steps, see our doctors or health professionals for advice.
Okay. I know you've been listening to us all this month of October. You're a lady, and it feels like what we're saying is nonsense because you've not taken any action. You've not done any breast examination, even this month of October. Please, you need to take it serious. I mean, we need our women alive. We need our mothers, our sisters. We need all of you alive. So let's take this serious. And for the men also, let's lend support. We're told that the men too, they can get some, but most important, let's lend support to the women as well. Thank you very much, Doc, on that. But today we're taking a look at prostate cancer. So again, I mean, on a general note, I want to know what prostate cancer is. And I'm thinking when we're talking prostate cancer, we're dealing more with the men, right?
Yes. Okay. It's men who have prostates.
It's men who have prostates. So the men, let's wrap up October with you. Prostate cancer. Doc, tell us about it.
The prostate is an organ that's it's about 4 centimeters wide by 3 centimeters high, and it's like 2 centimeters. So let's say maybe like the boiled granules, 2 small boiled granules put together. That's like the size of a normal prostate. Yes.
Okay.
And it's just beneath the rectum, between the rectum and the bladder.
Okay.
Yeah.
Okay.
So it's a small organ in there. So when the cancer usually occurs there, then it begins to multiply and then forms tumors and all those the same things that occur with breast cancer. Just this time it occurs in the prostate.
Okay. What are the symptoms of prostate cancer? First of all, do we know what causes it?
Well,
Like
not
cancer, we don't really know what causes
yes,
it.
so we do know there are some genetic links. There's actually the gene that is associated with breast cancer, the BRCA gene, is also associated with prostate cancer as well. So if you do those genetic testings, you might realize maybe you are at higher risk, or you might get prostate cancer later in life.
Okay.
But aside that, it's just the risk factors, usually the age. So usually men above age 50 years, and unfortunately it's also common in black Africans. Yes, more than other.
But I was going to ask you, like we said about breast cancer, if any man at all can get prostate cancer as well.
Yes, but more often it's more black men than other, like Asians and other people.
Anyway, we'll look at the risk factors. I have a question I'll ask you on the risk factors.
Okay.
But what are the symptoms of prostate cancer?
Okay, so early stage prostate cancer actually doesn't really have any symptoms. Yeah, so you won't really know unless probably you do some screening tests.
Okay.
But as it progresses, when the prostate gets enlarged or gets inflamed, or there's a spread of the cancer, then you will see those associated symptoms. So sometimes you have frequent urination, small, like every 20 minutes you feel like urinating, weak urine flow, so you want to urinate, but like the urine is coming very weak, like the stream is very weak. If you get what
I get you. You know, when we are kids and then we are urinating, you are competing who will go the farthest.
Yes.
When you are growing, you realize that no, you can't do that competition anymore.
Yes.
So I understand that point. Yeah.
Yes. So, and also when there's a burning sensation when you urinate, when you have urinary incontinence, so sometimes you not even realize you feel like urinating before you realize if you urinated on yourself. Then there's painful ejaculation.
Okay.
Or sometimes there's even erectile dysfunction. That could even be the first symptom of the prostate cancer.
Wow.
Yeah. Sometimes there's blood in the semen, and when it has spread, you could have back pain, low back pain, pain in the bones.
Okay.
That means the cancer has actually spread to the bones. And sometimes if it has spread to the rectum, you have fecal incontinence. So that one, so you don't realize, before you realize
it's out.
Yes. Yes.
Okay. But some of the symptoms are quite generic. I mean, frequent urination, for instance. I know when you have diabetes, you can have that. Some of
you
it
have a urinary tract infection.
Yeah, infection. You can have. So how do you know? How then is it diagnosed that okay, this is prostate cancer?
So you have to come to hospital when you notice certain symptoms for the test to be done, and especially if you are at risk, at a higher risk. So your age puts you at risk. You are a smoker. You have obesity, or you have a family history of prostate cancer. So once you know you are at risk and you begin to see those symptoms, then you should rush to the hospital and at least do some tests and make sure everything is okay. Okay.
And these things you mentioned, I think those are the risk factors.
Yes.
Let's get into it.
Yes. So what I mentioned, those are the risk factors. Other risk factors are when you have a lot of prostatitis, that's infections in the prostate, usually bacterial infections, or you have a lot of sexually transmitted infections. That can also put you at risk of prostate cancer. So I know some people have been encouraging that if you have more sexual intercourse, it reduces your risk of prostate cancer.
They tell us that.
I'm not sure about that, but if you are not doing it safely and you are getting a lot of infections, you're actually rather putting yourself at risk of developing prostate cancer later in life.
Okay. Now, let's look at the different stages of prostate cancer.
Okay. It's kind of like how we stage the breast cancer, but it's a little more simpler. So we have what we call the local, the regional, and then the metastasized. So if it's local, that means it's just within the prostate tissue alone. Yes, and then if it's regional, that means it has entered into the neighboring tissues around the prostate. So maybe the bladder around that area, the areas that are directly touching the prostate. And then if it's metastasized, that means it has gone through the lymph nodes to the blood, to the bones, to other organs.
Okay.
So yeah.
Okay, so those are the stages.
Yes.
Can we look at treatment? Is it treatable?
Oh, yes, very treatable. Actually, prostate cancer is usually a slower growing cancer as compared to breast cancer that grows quite fast. Most often, especially in the elderly people, it grows very slowly. So it's actually something you can actually treat. Once you are able to pick it early enough, you can treat it quite quickly, and the earlier you get it, the simpler the treatment is, and the more normal you can have your life.
What are the treatment options?
Okay, so depending on the stage, if it is just within the prostate itself, we would do a prostatectomy, so they just surgically remove the prostate. So depending on how far spread within the prostate it is, they might remove just the prostate, or they might remove the prostate and then surrounding tissues. There's also radiotherapy that can be done as well, either together with the prostatectomy or on its own.
Okay.
Yeah. There's hormone therapy, because it's the prostate cancer cells respond to testosterone.
Okay.
Yes. So usually they will give you medications that block the action of testosterone to block the cancer from growing. Other people would opt for removing the testes, surgically removing the testes, because the testes are what produces the testosterone. So once they remove that, then they are no longer giving the cancer cells what they need to grow. Yeah.
What are the effects of that?
Well, of course, that one is definitely going to be infertility. You won't be able to have children. It may or may not affect your sexual function itself, but your ability to have children, because of the testosterone helping with the sperm production, you will not. So probably you have to maybe give some sperm at a sperm bank down before you go and do such a procedure. Yeah.
Okay, so let me ask you more of a two-in-one question, because I know I don't know how the cancer itself affects the quality of life of the individual, but I also want to know how the treatment would affect the quality of life, including urinary and probably sexual function as well of the individual.
Okay, so yes, as I said, depends on the kind of treatment. So with prostatectomy, depending on how radical it is, it may give some urinary incontinence, but usually the urinary incontinence is temporary.
Okay.
Yeah, it's not permanent, maybe for like a year or so, but after a while you should be fine. And radiotherapy, sometimes it can affect the nerves, as well as also depending on if it's a more radical prostatectomy, it can also affect the nerves. So then there might be some erectile dysfunction. That one as well may be temporary or maybe long lasting. It depends on the age and all that. Yeah. So, but usually the erectile dysfunction, we have the medications that can help you to gain the erection, like the Viagra, that is popular. Okay. Yeah. So with that,
so the Viagra, it has its use. Sometimes it feels like people are abusing it. When you mention Viagra, I mean, to me, I think like, okay, why do you need Viagra? But it can have its use.
Yes, it has its use. Yes. All medications have their use, but a lot of them.
Sometimes I hear of young guys, who are taking Viagra. I'm wondering.
Yes, and they are actually putting themselves at risk by abusing the drug. Yes, but usually it's for people who can't actually get the erection, and then that helps them to get there. But if you can get the erection on your own, and then you add, it's actually.
You want to go the distance.
It actually causes more problems in the long run. So.
Okay.
Yeah.
Okay. So it feels like those effects, most of them, that doesn't look like permanent, like the temporary effect.
It depends on how far advanced the cancer is.
Okay.
Yes. But if it's not that advanced, the effects are not permanent.
Okay. Any lifestyle changes that one has to go through to improve prognosis and overall health?
Yes. So the first thing I'll say is regular screening. So let me talk a little about regular screening. Yes. So especially those above 40 years old, every year you have to do a test we call the PSA, prostate specific antigen test, and that's
again the name
PSA.
PSA.
Prostate specific antigen.
Okay.
Yes. So it actually gives you an indication of the activity of the prostate in the blood. Yeah. So usually it shouldn't be more than 2.5 nanograms per ml. So normally you see people maybe 0 point something, 1 point something. That's normal. But when it goes above 2.5, then you have to keep an eye on it depending on the age. Usually we extend the cutoff points for the elderly. So maybe if you're above 50, maybe we'll give you the cutoff points of like 3.5. If you're above 70, we can give you 4.0, 4.5 and all that. Yes. But as a younger person, 40 years, you shouldn't go beyond 2.5.
Okay.
Yeah. Aside that too, there's also what we call the digital rectal examination. That's when the doctor will have to palpate. They'll have to use their finger to actually feel the prostate organ itself to see if it is enlarged, to see if maybe the surface has become abnormal or has become rough around the edges or has become painful to touch. Sometimes you might not feel anything, but when they do the rectal examination, then you realize that, oh, there's actually pain there. Yeah, so then you realize that there's actually a problem.
That will feel uncomfortable.
Yes, it's uncomfortable both for the doctor and for the patient. But it has to be done because we need to be able to catch these things early.
Is it an either or you would have to do all together? Do the PSA, do the...
Ideally, you should do both.
Okay.
But because it's not very comfortable, we prefer to just maybe do the PSA and then maybe we'll use an ultrasound to measure the size. But once we get something that we are not sure of, we would definitely have to do the examination. Or if you have symptoms, we definitely have to do the examination.
Okay.
Ideally, we should do it all the time, but because of discomfort and shyness and all that. Yeah. So,
okay.
Yeah.
So those are the screening.
Yes, those are the screening regularly.
And you're saying that annually?
Annually, yes. So once you are 40 years and above, every year go to the hospital and say, let me do a PSA test.
Okay.
And that's all you need to just ask for. They do it for you. Once you are within the normal range, you should be fine with yourself for the year.
Okay.
Yeah.
All right. I don't know anything that we want to add to it before we wrap up.
We were talking about the lifestyle.
Yeah.
Yes. So on top of the regular screening, you have to maintain a healthy weight. It's because it's been associated with obesity as well. So try to maintain healthy weight. So that means healthy diet. Try and do regular exercise, at least some 30 minutes of brisk walking every day. Just be able to lose some calories and stuff during the day. Not especially those with sedentary lifestyle. They sit behind a desk all day. When you close, do some walking.
Yes.
Yeah. And then stop smoking, please. Smoking has been associated with all sorts of cancers.
Yeah.
So please, if you are smoking, please stop and then reduce your risk of cancer.
Alcohol?
Alcohol, I didn't really see a connection with alcohol directly to prostate cancer.
Okay.
Yes. So,
but maybe alcohol in moderation. I mean,
everything in moderation.
Yeah.
Yes. Yeah. If you take too much alcohol, you are putting yourself at risk of liver cancer as well. So
okay.
That ways, yeah.
All right, that's great information. Anything that you want to add to it before we wrap up on prostate cancer?
Yes. So not every enlarged prostate or prostate symptoms is prostate cancer. We have what we call BPH, that's benign prostatic hyperplasia, and it usually occurs as a man grows older. The prostate size tends to grow, enlarge bit by bit.
Okay.
So usually elderly people would also have these symptoms of weak stream and urinary incontinence and all those other things caused by just the enlargement of the prostate, or sometimes there's blockage and they are not able to even pass urine at all. Yes, so just because you have the enlarged prostate does not mean you are at a higher risk of having prostate cancer.
Okay.
Yes, so just know that.
Okay.
Yeah.
All right. Thank you very much, Doc, for your time and the education this afternoon.
Sure.
It has personally benefited me. So thank you for coming this afternoon, and have a lovely week.
You too. Thank
All right.
you so much.
So that is Dr. Emefa Dzide. She's a senior medical officer at Wejagbawe Municipal Hospital. Today, we talked about prostate cancer on our Hello Doc segment here on The Drive with the Area Gang. We'll take a